Hi, I'm Dr. Nulty, and this is my practice, Dentist on the Rock, and today you're going to watch a live surgery video. Everything's been consented to by the patient, and I'm the course director for Osstem's SMOP course. SMOP is a guided implant surgery system that's been developed by Swiss-Meda in Europe, and it's used around the world. It's very, very accurate. It's accurate for a fair few reasons, but I won't go into that now. I'm going to show you the case, and you'll see a video of the case and a few pictures, and then you'll see the live surgery, and at the end you'll see the radiograph to show how accurate it is. If you have any questions, please feel free to get in touch with me, but otherwise I hope you enjoy the video. Okay, thank you. Hi, so this is the SMOP software, and on the top left here we can see the 3D CT scan and the guide that's been designed by the lab, by Hugo from Nimrodental. And this point here, this is where the angle of where the implant's going to be placed, and you can see that this is where the key is going to sit in, and that's what's going to give us the accuracy. And the other three screens are the different planes of where we designed the implant. So obviously I've placed it a little bit more platal to give us a little bit more buccal bone, which there's plenty. And we designed this position here. Now I've designed this position here to give us enough height for a good emergence profile, and you'll see at the end how accurate the end result is with the post-op radiograph, and we can compare the two. The first thing I'm going to do, I'm taking the drill guide, and I've already checked this before we numbed up the patient, but I'm checking that it's the fit that I've asked the lab to create. Like I said when I was teaching yesterday, I don't like it engaging too much undercut and flexing and clicking into place. I'd rather it be a passive fit, but I still want a little bit of attention, and there is. But what I'm doing, I'm checking on all the points to make sure that the guide is sitting down on all the four or five places where it's connecting. So here, 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 and here. And if it's resting on all of those different parts, then I know that the fit is accurate, and I know that the guide is going to be accurate for where I'm going to be drilling here. When I'm doing the drilling now, I'm going to be taking this in and out a few times, and that's one of the other reasons why I don't want to engage in the undercuts too much. But that's my personal preference, and like Florian said, the SMOP guide can be very easily adapted to suit how you like to work. So the first thing we're going to do, we're going to do the tissue punch. Now, when I'm doing the tissue punch, at all times I love my finger rests. I'm going to try as much as I can to finger rest everything. Holding out the way, Janine's going to be catching all the water, but I've got, with the SMOP guide, and you've got the same at the bottom, you've got this arch connector here. I usually tend to use as a rest because it's central to the placement of the guide. And if I hold that there and I'm using a finger rest for my drill, then I know that I'm going to support everything in a nice way. So the guide should fit very, very snugly the tissue punch. Now I'm going to try and lower this down a little bit, just to see. Can you just hold that there, Jenny, and I'll try and position this? Just put your finger there.
Yeah.
And try and so that you can see over the top. That's better. There we go. So, why I'd wanted to do that is so that you can see when I place this through here how snug a fit it is. It is a very, very tight fit. Maybe I'll try and get this a little bit further away. That's better. There we go. So you see now where my finger rests and everything. Okay, so I'm supporting it. Tissue punch. Popping that through. And then you're going to feel a little bit of pressure now, Elizabeth. Okay. Remember what I said, if you need me to stop at any time, don't be afraid of asking. Okay. So pressure, pushing in. Remember what I was saying as well, that the arch, the crest of the arch is never completely flat. So when you see that taking that guide away now, you can see this tissue punch, and you can see that it's pretty much bang on in the middle there. I've designed the guide so that we've got this skeleton margin. I'm going to be replacing this little soft tissue punch later on, so we have more gum. Now I could have put a flat there. This is just for ease of use, and I like replacing this. It's a little bit like a gum graft. But worst case now, we've still got a lot of basically incidental trapilla remaining in between, so the end result is going to look really nice there. Take a look. Okay, so the next stage, you're going to remove this little soft tissue coating. So all I'm doing is I'm gently scooping underneath where that soft tissue punch is cut through. Now, like I said, the crest isn't completely flat, and so because it's not completely flat, you'll still have a little bit of attachment around the edges. So it's pushing that, but again, I'm using a tissue finger rest to support that action, okay, and then it just pops away. Now I'm going to pop this in some saline. Next step of where this is going to go, this is over the top. And I'm going to create the accuracy by making sure that this is fitted well by using the initial drill. The initial drill is going to fit perfectly into the guide, and it's going to create the path of all the other drills we're going to use. So that's placed in here. And you can see whenever I'm using the drill, I'm always doing that pumping action that I described, just to let a little bit more coolant reach out all of the areas that I need to. Keep that on. Now, just because I'm a stickler for safety, I always check every step, making sure that I can feel the crest of the bone. It's going to be exactly where I want it to be, but I want to make sure that that is where I want it to be. I want to feel that there's a good hard crest there. So the implant that we've designed on the software, that hopefully you've had a chance now to design on SMOP in the background, is a 3.5 by 11.5. The key, you'll see, fits in really nice and snugly, forcing that in there. And then I'm going to support that with my thumb in the back part here. And if I support that, I'm going to try and prevent any vibration. Even if I try, it doesn't really move that much because it shouldn't do. It should be a nice tight fit. But I want to try and make sure that there isn't any vibration to decrease accuracy. And again, the key is very tight. There's only a little bit of tolerance there. And that should fit perfectly down that path that I've made. And you can see I'm pumping all the time. When that water's flowing there. Again, you can see that the key takes a little bit of effort to pop out of that. You okay, Deborah? So I'm checking again now. I've reached the full extent. I'm making sure that I've got no perforations, that the osteotomy is accurate, and it is. I want to make sure that I can feel the end of it, that there's no problems around any of the areas where I've prepared. And there's not. I'll be ready in a second. So the next step, I'm widen it out now. So we're prepared to the full length, the 11.5mm. The next key is a little bit wider. Again, we slot that in. Feel a little bit of vibration again as this goes through. And again, pumping through. Take it a little bit deeper. Let the water cool it. A little bit deeper. Let the water cool it until the drill stop reaches the end. And then I'll let it cool a little bit more again. Now, believe it or not, that's all the drilling done there. Is that okay? So again, I'm feeling the fully prepared osteotomy. Everything's lovely. We've still got a good shoulder bone here, all around. Perfect. Ready? It's okay. So the implant comes non-mounted, and what that means is that there's no mount in the chamber for you to connect to. So inside the implant there, we have to connect something to be able to use it in the guide, and that's the guide mount. There, if you can see, that's it. So that screws into the implant. Just gently let it rock into place. There we go. And then the screw just pops into place nicely. And then use just a normal mount extension as with any of the guides. I'm hoping this isn't on the recording. So then we connect the torque wrench, and that's it picked up. Lovely. Got two levels of accuracy. You've got the accuracy of the drill itself, and you've got the accuracy of the placement of the implant, because the implant's then also guided through here into the prepared osteotomy. But then the guide mount, when that engages through that tube, will in itself make sure that the implant is at the right angulation, depth, and I don't know if you'll be able to see, but there's a little, I'm going to try and just show you from the side. There, but there is a little depth stopper on the guide mount, and that's there. Now, when I'm taking this down now, then this will just go very gently and easily down, very well, until that depth stopper reaches the edge of the guide. And I take it very slowly until I just feel it hitting that, only just, and then I'll know it's exactly where I planned it to be. I'll take everything off. And then we unscrew. Now sometimes it's a little bit tight in there, that's because of the accuracy. I'll just wiggle it a little bit. That doesn't want to go, and what I'll do, swap the torque wrench round with it unscrewed and just ever so gently pop it off, taking it the other direction. It shouldn't unscrew the implant because I'm not engaged the implant with the screw, but what I should do is loosen that. And there you go, that's the implant in. Yes, try that. So, I'm going to be placing a cover screw, a long cover screw, that's going to sit under the gum a little bit. the cover screw there. Take that in. In fact, maybe it's over because what I didn't do, just check the bone level. Like I said before on the stickler, so I can feel the edge of that bony plate there, and I can feel that the implant is just ever so slightly subcrestal, exactly where I planned it in the guide. So I can feel that there, and feel the implant there, just slightly subcrestal. The same buccally, I can feel the buccal plate just under this little soft tissue, and then a little bit deeper, the implant. So I know then that I've got the amount of bone in all directions that I planned. Then replace the cover screw. Just hand tighten that a little bit. That's lovely. And then this is my personal thing, my personal preference. You don't have to do this, you could use a healing abutment, but because I want extra soft tissue, I'm basically using the soft tissue plug. So I'm a big fan, I like periacral. It only lasts a week or two, but it saves a lot of harm with the tissue. And it seals it very nicely.
Okay, and then just put, there's a thing in there as well, a tray.
You just put a drop in there and I'll suck it up. No, just pop those. So I'm not going to touch it.
And then just put a little bit of that into one of the end ones.
Yeah.
Yeah.
Maybe a bit more. Okay, so this is the periacral. It's purple until it sets and goes clear. I'm just gently putting a fine layer of that. And then I'm going to just leave that to seal. This takes about 30 seconds to set fully. And it forms basically a little scab, which drops off after a week or two. It's exactly the same chemical as superglue, cyanoacrylate, but it's the surgical form, the periacryl 90, and you can get it from Henry Schein, and believe it or not, developed by the US Army in Vietnam. Okay. Are you okay there? Mm-hmm. That's now all crispy. That's good. Make sure everything's wet with Forcidor, if there's anything remaining. And that bit, yeah, you're done. Perfect.
Okay. Mm-hmm.
Job done. That's it. And that's everything. That's everything. I hope you enjoyed it. I hope you enjoyed watching. I'm going to be heading back soon. By the time you finish lunch, we'll all be back. And if you have any questions, like I said, write them down.